We're deeply concerned both by the alarming levels of spread and severity and by the alarming levels of inaction.
Taiwan, one of the first countries to flatten the curve of the COVID-19 pandemic. How did Taiwan brace themselves in the pandemic, and how did they do it? With Taiwan having experience in the SARS outbreak back in 2003, the country and its people have prepared enough for the COVID-19 pandemic. According to Taiwan's Central News Agency, Taiwan has responded to the pandemic following rapid measures, early deployment, government transparency, and the citizens' obedience to the rules and regulations. Even before the World Health Organization declared the COVID-19 outbreak as an international public health emergency, Taiwan has already deployed a series of response strategies. As of today, April 19, 2021, Taiwan has only a total of 29 active cases. Only 14% of Taiwan's total population has been vaccinated, and despite this, they have still managed to flatten the curve of COVID-19.
South Korea experienced a surge of COVID-19 cases on February 19, 2020, but was able to flatten the COVID-19 curve in only 20 days without enforcing a lockdown. Korean experience was examined and in-depth analysis was conducted on the South Korean government's experience dealing with the Middle East respiratory syndrome of 2015. Three prominent factors were identified behind Korea's response against COVID-19. First, it was crucial that the government responded as a one team efficiently to cooperate and respond to COVID-19. Second, a novel approach was needed to combat COVID-19 spread. Information and communication technology had a key role in South Korea's strategy to contain COVID-19. Third, an effective response to COVID-19 was possible due to the successful partnership between the general public and state authorities.
The country Georgia, which is the intersection of Europe and Asia, reported 71 cases of COVID-19 as of the last day of September 2020, taking the tally of total confirmed cases in the region to 1,458. In the meantime, 32 more persons have recovered, increasing the number of recoveries to 530, with 11 recorded fatalities since the outbreak of the pandemic. The number of active cases in the region to date stands at 917. Despite the continuous active cases, Georgia likely to have flattened their curve. They conducted precautions and safety protocols like suspending direct flights with emerging hotspots as soon as the COVID-19 arises, began profiling and set up quarantine zones for travelers arriving from abroad, and had a massive public awareness campaign. Schools were closed and targeted lockdowns were put in place when Georgia first had only 3 confirmed cases. After announcing of the flattening of the curve, Georgia has reopened local tourism and will welcome international tourists from countries where infection cases of COVID-19 have not been confirmed.
Canada has been able to implement more extensive testing. Canadians have closed schools and shut down large parts of the economy to deal with the threat of the novel coronavirus. Canada set up an infrastructure in January to perform tests and touch tracing. The fast response is based on Canada's experience with SARS in 2003. Canada also has a well-funded universal healthcare system which serves as a forerunner to a large-scale disaster. Canada's response to COVID-19 is being driven and determined by public health officials, not by politicians.
Thailand's success in flattening the curve occurred even though they were the first country to detect a COVID case outside of China. These are 3 reasons why Thailand is successful in mitigating the spread of COVID-19. First, they have fact-based communication. The Thai government started the Center for COVID-19 Situation Administration as a platform for daily updates and statistics. The CCSA spokesperson, Dr. Tawislip Visanuyotin, presents data like daily cases, testing, and government response in a transparent manner. Second, their social norms. Thais are also known to be very conscious of their hygiene. This means that they were able to quickly adapt to preventative measures to reduce the spread of the virus. Third, the Thai government fully supports the healthcare sector of the country. With this, the healthcare workers were able to do their jobs efficiently and quickly with full support from the government. With the Thai government and the people of Thailand cooperating, it is no surprise that Thailand was able to flatten the curve.